we have these alveoli. So we all think somehow who have not studied about the physiology or may have forgotten that alveoli are not completely independent structures. Okay, they are all very well interconnected, though they are like balloons only, but they are all interconnected through these communicating channels. Okay, each alveoli, it is not independent. They are all connected. They are interbronchial connections. They are bronchiolo-alveolar connections, and then there are interalveolar connections as well. So if somehow, like these are the names of these, you can also memorize these names. The interbronchial connections are called as channels of Martin. Then bronchoalveolar connections are called as canals of Lambert, and then interalveolar connections are called pores of Kohn. Pores of Kohn are more commonly like quoted, so that's why I think maybe most of you have heard about pores of Kohn, but they are all interconnected. And what is the advantage or significance of this? Because it is very important for you as a physiotherapist to know that these collateral and communicating channels exist because they are the mechanism behind so many of the techniques that we use in clearing the airways. All right. So, for example, if there is this mucus plug which is obstructing this particular, there are channels everywhere which are connecting. This one is open, and this has mucus, and this has completely obstructed this particular alveoli. What happens is you can, with the proper technique, use these channels to actually propel the secretions out from behind the alveoli, make it come to the central airways, puff it out, and hence opening the atelectasis and what you call is uh, were opening the blockages and collapsed alveoli and collapsed lung as well. Okay, so when I say that there is lung collapse, what is happening in the lung collapse? It can either be because of other pathologies like there can be a pneumothorax or there can be, any mass which is obstructing that pathway or things like that. But if there is a lung collapse because of secretions or because of excessive mucus production or a mucus plug has completely blocked the main bronchuses, then what you have to do is you have to use these channels and hence propelling it out and opening the collapsed lung with the right technique. So these are the basis for most of the airway clearance techniques, that alveoli are not an independent structure. They are all interconnected through channels and canals and pores, and hence you as a physiotherapist use these to open the lungs and clear the secretions. Okay? So basically, like it is not just a mucus; it's a bad thing. All right, mucus is as good for everybody if produced in the amount which is normal. So normally, me and you, everybody have the protective mechanism where our lungs and the goblet cells they produce mucus, and then every day our mucociliary system it clears it out along with the infective agents, microorganisms, and stuff like that, and foreign objects. Okay, so it is a protective mechanism for everybody who is present on Earth, even like other animals and everyone who have lungs and who have this airway mechanism. Okay, so you and me, all everybody have our mucociliary clearance pathways, mucus, and hence clearance is happening on our own. That's why whenever you wake up in the morning, you clean your teeth, you wash your face, and then you just spit it out. Okay, so that way it is coming out. It is normal for everybody. Then you have cuff, which is a protective mechanism. Okay, so these are the normal lungs के अंदर, these are the airway clearance mechanisms which is existing. Okay, so mucociliary clearance is happening every day. You and me are producing 20 to 30 ml of mucus every single day. Okay, and it is effectively protecting us and it is effectively being cleared out by our normal mechanism. Then you have protective mechanism called cuff. Anything, anytime, whatever happens, like if you catch a mild cold or infection like that, not necessary that it's like very severe one, but even normal when you are actually having more secretions and nasal drips and all, so you cough and it comes out. Okay, so cough is also a very effective mechanism, not only in the disease condition, but reflexively also, like I just quoted, like while you are eating the food and somehow it goes into the windpipe, the reflex occurs and you cough it out, and you will keep coughing until it is out of the windpipe. Okay, it happens most of the time, it has happened, and that's why choking also happened, right? What happens, you are not able to cough it out because the food particle has completely blocked your airway, and hence it can even lead to death if the basic life support is not provided to the patient or person who has choked. So that is a different topic, but cough is the your protective mechanism, and it is there for your airway clearance. Then you have alveolar macrophages. So this what I'm quoting right now is in the normal physiology. It is the normal lungs we are talking about. Okay. Okay. Everybody on earth, humans, we all have this mucociliary system. We have mucus production. They are protecting us from the foreign particles and these bacteria and viruses, etc. We have a cough reflex, and then alveoli, they do not have mucus lining. You have to remember this. Okay, so they basically have alveolar macrophages. So even if the particle or even if the bacteria and viruses have escaped your this mucus lining and bronchuses and have reached the alveoli. So alveoli have their own macrophages. They will engulf and eat them and destroy them, and later on it will be coughed out through the mucociliary system. Okay, so in a normal individual, these mechanisms exist, and hence it is very effective for clearing out all these particles. The problem only arises when these systems stop working properly. Okay, so we have everyday basis, we deal with dust, noxious gases, pollutants, allergens, okay, and they are all with the host defense mechanism. They are all absolutely normally, effectively cleared out from our lungs and prevent us from developing any sort of disease or infection. Okay, so approximately 20 to 30 ml of the secretion is produced, and these secretions, which are necessary to protect the airway from foreign particle, are cleared by the mucociliary system. So this I have already told you. Okay, so the mucociliary escalators cover most of the bronchi, bronchioles, and nose. So it is composed of two parts, which is mucus producing goblet cells and ciliated epithelium.